Hey there again, it's Dr. Paul Gundian from First Choice Dental Center in Restore in 24 with our next case study series. Our next patient, she's only 32 years old. Her name is Anne Marie, and she came to us with a lot of broken teeth, a lot of missing teeth on her upper. Her lower's in pretty good shape, and she just wanted her smile back. She felt too young to, have these kind of issues with her self-esteem, with smiling, with chewing. And so she just wanted to start fresh, like most of our patients, and have a nice smile that she can chew with and live a great life with. So here's Anne Marie. As you can see, she has an old crown that fell off, and she has what we call a collapsed bite. So a lot of times when you lose these back teeth, your upper and lower jaws come together closer, and your lower teeth will damage these upper teeth quite a bit because you don't have those back teeth protecting front teeth. So we can see a lot of decay in this area over here, missing crown and broken down crown prep underneath, chipped tooth, collapsed bite, not much space here. So she has a hard time chewing and doesn't love her smile. Here's some side shots and front shots. So you can see just extend a little bit more, missing teeth in the upper left. Here's the x-ray. So here we can appreciate how much we're missing. So this is her upper left, what I was showing you. We have a big infection at the top left area here, where that canine is, broken down teeth, a little bit of bone loss, infection up here, missing teeth, sinuses, infection on this root. And so at this point, we gotta just start fresh, scrap it, and give her something nice. Here is after we took her initial photos, we overlaid our design up with our lab techs upstairs. And what we wanted to do is give her a nice big smile. And that was really what she wanted, is to be able to smile again. And so we did just that. We overlaid her new smile over the old smile. And with her practice teeth, we're able to have her just dialed in to where we want her to be. And here we go. Opened up her bite a bit since everything was collapsed, like I said. Try to put the teeth in a very similar position so it's a little bit easier for her to get used to her speech. And here's Miss Anne Marie's CBCT. So this shows us an in-depth look at what the bone looks like in terms of density, width, height, where the infections are, where the sinuses are. And so we'll start on the very upper right. So first of all, I see some really dense, good bone in what we call the pterygoid region up here. So we can place an implant up here just to give her a little bit more support. Not necessarily needed, but a nice little addition. Little root tip here that we'll take out, and then we get to this upper right molar, and we can see here big infections where the root canal failed, which you'll typically see in quite a bit of cases, that these root canals will fail over time. And sometimes that's just because they just didn't heal properly the first time around. Sometimes they get reinfected because of hygiene or other issues. But this case, you can see that there is an infection here. Move forward. Bone's a little on the thinner side, but it's very workable still. 7, it narrows up to about 6, very doable. I love 6. 5 is even doable, but typically I love it if we can get 7 or above. That is a dream. Here we go. Another infection on the canine here. Keep going. So right now I'm already planning doing a tilted implant up here. We got a nice area in front of the sinus, which is right here. We'll go forward. Take a look in the center. A lot of broken down teeth, more infections. And we place down the center over here. Come over here. Same thing. Moderately wide bone, not super thin, not super thick, but definitely workable. Come back, another infection at the top of this root, lots of infections, another infection at the top of this root, so we'll clean all that out during the procedure. And then a little thinner here on our tilted site, but we can get a nice implant over here. Lastly, we'll keep going through the sections here. And then lastly, we'll look at this back area where we put that pterygoid implant that we were talking about earlier. So up here, nice dense bone. All this whiteness is really dense bone, so that means that the implant will be able to anchor really well. And we got plenty of length to place a long implant here, and the width is wide enough. We got 8 millimeters, so we're in great shape here. So that's the CBCT, and that's what we use to plan the case in order to get the most precise results possible. And here is the x-ray afterwards. So we placed what we call pterygoid implants in the back just to give a little bit extra support when you have good bone back here. Typically what we like to do over here is to include these implants, just strengthen everything a little bit. Is it needed? No. Can you have a great restoration and a great result without it? Of course, but it's a nice little addition that we like to do over here. In the center, you see that we have those tilted implants and the 2 implants straight up and down. Nice and straight bone contouring, everything looks great. And here is the final result. So nice big smile. You can see just how much more lit up she looks before and after. and another happy patient.